Want to speak also?
နှစ်လနေတော့စကြည့်ရတယ်အဲ့ဒီဘိုးစေးအောင်သွားခဲ့တော့ဘိုးစေးအောင်တော့မှနှလုံးမှာပေါက်ပါတယ်ဆိုတော့ကြောက်ရှိတယ်
She found out when he was 2 months old because he keep falling sick and then he having fever and breathlessness and then there's no day that he has isn't cough so he be coughing like every day so she went into the state hospital and then from that hospital they were informed that he has a hole in the heart which is one of the congenital heart disease and then from there they were referred to the Central Children's Hospital.
Must be very devastating for parents to know their young child is sick. So now that his surgery, he has just gone through a surgery, and the surgery is a success. We want to know what hopes does mommy has for the child.
ညော်လေးလာတော့ညာကြီးပေါ့အဲ့သူတွေကကောင်းဆုံးနေတယ်တော့သိချင်တာပေါ့နော်
Okay. She, of course, she hopes the best for her kid, and then she hopes to support him to the best of his interest. Whatever he wants to do, she's now able to help him succeed his future.
We also hope that Min will achieve his dreams. Yeah? Okay, lastly, mommy, do you have anything you want to say to our audience?
Thank you.
Thank you to all of you. And thank you, mommy. Now, Dr. Ong, we realize he's rather small size for his age at 14 months. Can you explain how his heart condition has affected his growth?
He has a hole in the heart of a major category which is called a VSD. When he was diagnosed in Yangon, the first item was to see whether they could have done it there. The Yangon's heart surgeon felt he was too young for them to do, and too small and too sick. So, fortunately, under the New Skin program, we were able to bring the child and his mother over to KKH Hospital to do the surgery. We operate 1 day old. The smallest that we do is about 600 grams for the non-open heart. The open heart is about 1.8 grams, 1.8 kilos. The youngest we operate is 1 day old. So this age for us to do is the norm, so it's not a major issue. The important thing is that now that he, without the surgery, and he was sick quite a few times, he could have easily passed away either from lung infection or from heart failure. And if not for the surgery, if he survived that, then he could end up with what is called chronic heart failure, and probably if he has what's called Eisenmenger, he'll probably live about 15, 16 years old. But now with the surgery, his life expectancy will be as per normal population, and he would not require any medication. And
Really wonderful news.
Participate as per normal child in any category of activity that is so choose as per normal child. So his outlook on the point of health will be as per a normal child.
Right, great. How about the procedures that he has gone through for surgery at his age? Can you just briefly share with us?
As I mentioned, we operate 1 day old, 1+ kilogram. So the procedure itself, from a category of 1 to 10, 1 being the simplest and 10 being the most complicated and the most severe. A VSD, even of this age, or even at 1 month old, is probably in the category of 3 to 4 in terms of risk and complexity for the operation to be done at the KKH Hospital.
We are really glad that the surgery was a great success. Now, over the years, New Skin Singapore has collaborated with KKH on different initiatives and saved many lives. Dr. Ong, can you tell us more about the collaboration and how it has helped to save children?
With pleasure, I will expand on this. The collaboration has been since 2012. And there are 3 aspects to it. One, as you can see, the child represents the human face of the collaboration. That is, to operate on these children with heart disease, heart problems, and to get them well so that they have a chance for normal life. That is for the child. And for the parents, in Myanmar and a lot of the underdeveloped countries, the strain financially, emotionally, and socially, family-wise, is tremendous. When the child is very sick, they literally will have to spend, even their salary will not be enough to look after. So for the parents, with the generosity of New Skin, that the child is able to have a successful operation, it takes a great load from them and allow them to concentrate on the other families, members, the other children. I think that is important. So from the child, so one for the child, the baby itself, they have a chance to have a normal life. For the parents, a relief of the financial burden and of the strain of looking after a sick child. And thirdly, which is equally important, if not more so, is that we, under the program that New Skin had provided the resources, the financial resources, the KKH Hospital, the team goes to Myanmar, to Yangon, and we share our knowledge, our expertise. And we have this philosophy of helping to train the trainers so that the surgeons there would be able to operate. And not only to operate, would be able to train their own people. And that will ensure a robust program that will continue to grow within the country itself. Let me share with you, for financial year 2018 to March 2019, New Skin has provided 129,000, if I'm correct. That's right. That 1% that you contribute, like the proverb, little grains of sand, little drops of water, makes a mighty land and a mighty ocean. The 1% you contribute, cumulatively from 2012 to date, it is 1.05 million. And what has this money achieved? So I'm happy to say that over these years, we go to Yangon, we operate with the surgeons there, train them and whatever, directly 120 patients, and we bring back the more complex cases that they are not able to deal, 20 patients. All have done well. But more importantly, our focus is with the Yangon Children's Hospital in Yangon, which started in 2012. When we went there, they were not doing open hearts. They were not doing a lot of the heart surgery at all. Today, the last trip that we were there, that hospital itself is doing 400 to 600 operations a year.
Thank you, Dr. Ong. So you see, your 1% has really gone a long, long way to help many, many families and children like them. Thank you, Dr. Long, again. Thank you. Can we have another round of applause for them? And next, I'd like to invite on stage our corporate management team and the Southeast Asia Children's Heart Fund board members from Singapore and Malaysia.